Hey everybody, quick video on the WHO Executive Board meeting that's coming up this week. Executive Board is kind of like a subgroup of the member states that get to do more of the planning because there's over 190 member states and it would be too wieldy to try to do a big meeting with all of them around setting agendas and stuff. So there's 34 member states. You can see if your country's on a member state list this time around for the Executive Board. Their terms last about 3 years. Now, this week, there's going to be a couple of different items that you might want to take a look at. There's going to be a follow-up to the 4th high-level meeting on NCDs and mental health. This is the New York meeting that happened in September. There's going to be some debates on universal health coverage, and there's also going to be some debates around the UN 80 program. They're saying it's like a reform of the UN. The WHO is part of the UN, but it's part of the larger global health reform that comes with the withdrawal of the United States from the ecosystem, but then also a lot of the other member states are cutting back. So it's kind of a reaction to that. Now, NCD Alliance does a good guide, so you can follow along. Also, all the agendas and some of the background documents can be found online. You might want to look through them. The live stream will probably work, and they usually will have it in all the UN official languages. So that'll be English, Spanish, French, Chinese, Russian, not Portuguese, unfortunately. Check it out. We'll leave some links. If there's anything interesting, we'll talk about it. But kind of the big disappointment for our group is that diabetes is not really talked about that much. There's kind of a passing mention to it, in the high-level meeting stuff, but there's not really anything that's going on around like the targets or anything like that. So it might be something if you belong to one of the 34 member states that are part of the executive board, you might want to ask your country why you're not talking about diabetes. It's a big deal. Okay, I hope that was helpful. Feel free to follow along with Voices in Action for future updates. Bye-bye.